Hello, women in midlife. Today, I'm very honored to have Dr. Teo Mei Shi, who is a good friend, as well as, on top of that, a very, very smart woman who is an expert in breast cancer. And she is a surgeon that specializes in breast cancer as well as reconstruction based in a Penang hospital. So I'm going to pass on the introduction to you, Meiji. Hi, Meiji. How are you?
Hi Karen, hey, thanks for giving me this opportunity
I
to
am
share.
so honored. I wanted so desperately to share this knowledge that you have with our audience. As you know, our audience are generally 50 and above, menopausal. And I feel that one thing that you could share with us, most importantly, is how to do a self examination that we can do easily at home. And if you could show us, and then we'll go from there.
Okay, breast self-examination is a very important form of method that we should know that we should be able to detect for breast cancer.
Okay.
All right? So basically it's a very simple thing, and I'll just use this prosthesis as a breast.
Okay.
And how do you do it is that you can do it at any time, anywhere. I mean, you can do it at any time when you are sleeping or when you're taking a shower.
Okay.
Right?
Okay.
So this is one of the method of understanding your breast so that you know how to examine.
May I know, is it better lying down with some moisturizer, or is it better when we are showering standing up? Which is better for us?
So you can actually do it both lying down. Actually, you can do it both lying down when you are in bed at
Okay.
night before you go to sleep,
Alright.
or you can do it even when you're showering. It's not a problem.
Okay.
Okay, because it's on your own body self, so you will know how much of pressure that you need to use.
Understand. Okay.
Yeah.
Cool.
Okay, so imagine this is your own breast, and all you need to do is you examine using the pads of your 3 middle fingers,
Right.
right? And you need to press down onto your breast
Okay.
tissue, and it should not be feeling a lot of times the women will feel on the skin, oh, this is how I examine my breast, right? And the skin feels smooth like how you examine your face.
Okay. Okay.
But this is not the way. You should press down into your breast so that there's some pressure. But
Okay.
because it's in your own body tissue, so you will know how much of comfort or discomfort you will have.
Okay.
All right?
Okay.
And it should be pressing down and in a circular motion. So
Right.
basically, it's just like giving yourself a very good breast massage.
Okay, like a deep tissue massage.
Yes, like tissue massage. All right. So you can do it from the middle, from the nipple area,
Okay.
and then all the way in a circular motion.
All right. May I ask, what are we trying to feel? What are we trying to
Okay, so basically this is like your breast tissue is like your pillow, your soft pillow, all right? And what you're trying to feel is any lumps or any irregularities or any abnormalities that was not felt before.
Okay.
So if you're the first time feeling it, then you might think that, oh, my breast feels very lumpy, or it feels very hard, or some people's breast feels very soft, right? So everybody's tissue is different.
Right. Okay.
So when you start doing your monthly breast self-examination, it should be done monthly, and then you will know how your normal natural breast tissue will feel like.
Okay.
All right?
All right.
So if there's anything that's unusual, then you know that, oh, this is something that's new that I've not felt before.
Okay.
So similarly, I use this analogy of sleeping on your own pillow at night.
Right.
You will know how your pillow feels.
Yes.
But if you're naughty kid, put in a ping pong ball, and then
Right.
you feel something that's hard, then you know that, hey, something is not right.
Okay. So you did say that you should do it monthly. Those who may still be having their menses and all that, is there a specific time or not?
Yes.
Okay.
If you are still menstruating, then do it 1 week or 10 days after your last day of your menses.
Okay.
All right, because during your menses, you can have some breast discomfort, like swollen. It can be lumpy. It can have an uneasy feeling.
Okay.
And this can change the results.
Okay. Understand.
So if you are menopausal, that means you have no more menses anymore, then you must remember to do it once every month, either the beginning of the month or end of the month, or if you have a special date that you want to do it, then you just remember to do it every month.
Okay, so let me reiterate for our audience. Imagine if this is your breast and you're pressing it with some pressure, and then you go, do you want to go
You can go in a
clockwise?
circular motion.
Okay.
All right, all the way from the nipple, all the way out. Your breast tissue starts from the below your collarbone until the end of the upper part of the abdomen.
Okay.
All right, from the middle of the chest until the axilla or the lateral chest wall.
Okay.
All right, so that's the whole area of your breast tissue.
Right.
All right, so you can do it in a circular motion, or you can do it in an up and down movement.
Okay.
Okay. Anyhow, there's no special
right
way.
and wrong.
to do
Okay.
it. Yes,
Okay.
correct. Some people do it in the quadrant area.
Right.
That means they put the whole hands and they press down.
Right.
All right.
Okay.
Now, one thing that you shouldn't do is go and grab your breast.
Okay.
Oh, I have some patients who come and say, I feel a big lump. And I say, where's the lump? This whole thing is the lump. We all have breast tissue.
Right.
All right. So when we are young, the tissue is firm.
Okay.
All right, and dense.
Right.
So that's why you will feel that there is a lump there.
Okay.
Right? This is very normal. So that is not the way to examine your breast. The way is just to press down and massage in a circular motion using the pad of your 3 middle fingers.
Understand. Now, there's this thing that I've read, and some people say, oh, if you feel a lump, let's say in January I felt a lump, but then in February the lump disappeared. So is that more dangerous, or if the lump is still there in February, let's assume? That means every month I could feel the lump. Is that more dangerous than I can feel it 1 month and then the second month I didn't feel it?
Well, that's why breast screening is important, whereby we advise you to go for yearly breast screening, which doing a mammogram and breast ultrasound. So detecting for any breast lumps or breast cancer is not just by breast self-examination.
Okay.
You have to incorporate the mammogram and the breast ultrasound together.
Okay.
All right. So that's why when you start doing that on a regular basis, and sometimes you feel it, then you don't feel it. Then if consistently you don't feel it, but you just recently had a breast screening in a very recent, then if you are worried, then of course please see the doctor.
Right. Understand.
All right, because I'm not in this position to tell you it's okay or not okay.
Understand.
Yeah. So anything that is unusual, if you're not sure, just visit the doctor.
Right.
Yeah.
Okay, just to educate the audience again, what's the difference between the mammogram and the ultrasound?
Okay, the mammogram is actually an X-ray image of the breast, of the whole breast.
Right.
So they will press your breast
Compress.
and then just take the X-ray image. Now the mammogram is important because it looks for little calcification. All right.
Okay.
And this is the gold standard method of detecting asymptomatic, for asymptomatic. That means you do not have symptoms and you go and do your mammogram.
Right.
And ultrasound is to detect the lump clearer, the breast lump clearer. Okay. So these days we will advise a mammogram. For Asian women, we will advise a mammogram as well as a breast ultrasound.
Okay.
Because it can help us to detect both the calcifications and as well as some very small lumps that cannot be seen on mammogram.
Right. Okay. And for most women have a smaller breasts, what would you recommend? I mean, there are some people who have this thing that they say, oh, I don't have much of a breast anyway, so they kind of discount it. Or even men who think that it doesn't affect them. We want your take on it. I think that I've heard cases that there are men who has breast cancer as well, right?
Yeah. So I think the size does not matter.
Okay.
Right? Regardless it's small or big, we still have to go through both the mammogram and the ultrasound as and when necessary. There is actually a screening guideline.
Okay.
Right? So if you are younger, less than 40 years old, then we will advise a ultrasound, and you are above 40 years old to 45 years old, then we'll advise both a mammogram and an ultrasound.
I see. Okay, understand. What's the ratio like of breast cancer these days? Has there been better medical studies based on it? What's your take on it?
Well, on the average, the incidence, we call it the incidence of breast cancer. So, okay, when we look at the developed countries like Australia, US, Europe, right? The developed countries, the incidence of breast cancer is 1 in 8 women. So if there's 8 women, right, around, 1 will be diagnosed with breast cancer. This is in the developed country, right? In our Asian country, although we don't have very strict data because we do not have a proper population screening program, our incidence on the average is about 1 to 15 or 1 to 18.
So
women who will be diagnosed with breast cancer. So if there's 15 women, then
one will get
it will be 1.
Oh my
goodness. For men, it is 1 in 70,000. So which means that it's definitely much lower, but that doesn't mean that men cannot get breast cancer.
Correct. Yeah. So in my I tend to prefer a more natural or holistic approach to it. And in one of the studies that I read, that most Japanese women do not have this high case of cancer due to their diet. Do you think, in your opinion, that our diet definitely plays a role in our health and how we can recuperate?
Oh, definitely. I think that not just diet, I think it's our lifestyle.
Yes.
So we do not have what is the cause of breast cancer, right? Because your example, lung cancer because of smoking. Now it doesn't go by that rule for breast cancer, right? Of course, we have certain high risk causes that can link to breast cancer, but generally, it is a lifestyle. It can be stress, diet, environment, general lifestyle.
That's
yeah,
right. Okay.
But there are certain risk factors that can be affected as well.
Interesting. I would like to ask you and clarify for my sake, what is a biopsy and how does that work?
Okay, so I'll just put it as this is part of the, let's say you have a breast lump, all right, and you detected that you have a lump, then the investigation will be, we call it a screening.
Okay.
A breast screening you do for mammogram, ultrasound, and then after that you go to do a biopsy. A biopsy is where we take a tissue sample. We call it a core needle biopsy, whereby a small needle, about the size of a pen, right, and we'll put the needle in and then we'll extract some tissue to sample the tissue to detect, to see whether is it benign, non-cancerous lump or is it a cancerous lump.
Okay.
Yeah.
And so that process will take what, long, or you will get your result pretty fast?
Oh, I mean the procedure takes about 5 to 10 minutes, and the results can take depend on the center. It can take between about a week, between 3 days to a week.
Okay.
Yeah.
So to kind of, if I am in I'm in my menopause stage and all that, what are some of the signs that I should be looking at, and how do I care for my breasts? What would you advise?
Right. So about the signs and symptoms of for to detect breast cancer, right? Generally, breast cancer lumps are painless. All right.
So that's dangerous.
They are painless. Okay. So that's why breast self-examination is very important, because we are able to detect a lump that is not painful. You wouldn't know, right? But you have a small lump.
Right.
So that's where you come for your screening, and then we'll do a biopsy and tell you, oh, this is non-cancerous or this is abnormal.
Right.
Okay, then we take it from there. A lot of times the patients come to see, they are worried when they have a breast pain.
Yeah, but it's now the opposite. That's
correct. Exactly.
I hope the women here will understand that, because I think that's the misconception, isn't it? And people think, oh, it's painful, but actually that's less of a worry than when it is not painful.
Yeah, it's painful. It doesn't mean that it's okay. I'm telling the audience that if it's painful, doesn't mean that it's okay. It's not cancer. It's painful means, yes, you just come and have a look, because it's just part of the physiological breast changes.
Right.
All right, but you still need to do your yearly mammogram and ultrasound just to make sure that the breast pain is not dangerous. Right?
Okay.
Yeah.
Okay. And it's in terms of breast care, especially that again, all this study about, oh, maybe your bra is causing your pain, or should we go braless, or all these things that goes out in the media. what's your take, and how the second question I have is, let's say I detected something, I checked, and maybe I'm at the first stage, in when I'm in the first stage, what kind of treatment, or what kind of symptoms do I expect to see, so that people who may be at the early stages may have these signs but they're not aware of it. What are the things that I should be looking out? Maybe am I looking at more fatigue, or change in the breast, the look?
The most important is the any recent breast lump. That's why you have to do your breast self-examination and your screening, which is mammogram and ultrasound.
Okay.
Your painless breast lump. If there are any change in the nipple, like if there's new nipple discharge, bloody nipple discharge, or yellowish, or if there's any change in the skin texture. All right, the skin can be smooth, but later on you find that it's a bit dimpled, it's a bit coarse, it's a bit hardened.
Okay.
Any areas of your breast that feels a bit hardened or unusual.
Okay.
All right.
Okay.
Yeah. So these are some of the so-called early symptoms.
Right.
All right.
Okay.
Even some people, they present with stage 4 breast cancer. They actually they look well, they feel well.
Right. Yeah, exactly. That's
You know,
the thing.
they are not like certain cancers where they get so emaciated, they can't eat, they can't drink,
Right.
or they feel so weak. Many of the early stage 4 breast cancer advanced cases, they do feel all right.
Right.
Really,
Yeah,
it's only
exactly.
at the later stage then only they start to have symptoms. That's why for breast cancer, sometimes in the early stage, we tend to ignore it.
That's what I'm trying to get your information, so that women out there who maybe, I'm sure you experience where some ladies are just terrified to do mammogram, terrified to do ultrasounds, and they think that if I don't check, I don't know means it won't happen. And
Yes.
and that's something I need our audience to understand, that that's not true. You got to at least be aware that, let me repeat, if there's any bloody discharge, am I right? Skin changes, so we are looking at dimples and maybe coarseness, right?
Caution.
Okay.
Nodules, little nodules,
Okay.
or skin ulceration, or any rash that doesn't heal.
Right. Okay.
Right.
All right. Okay.
Yeah.
And that means, we are not saying that it is, but that is alarm for you to say it's time to go and see your doctor and get the right help.
Yeah. So even like nipple that is retracted inside.
Oh.
All right.
Okay.
Yeah, and then you look at self. One of the other ways of examining yourself is looking yourself in the mirror, and then if you see there's unevenness, or one breast is higher than the other,
Oh. Okay.
right?
Okay.
And then you also can do like, you lift your hands up and you can see the breast tissue comes up together, or some like if you lift up and then one is uneven.
Okay. Okay.
All right.
Yeah.
So all these little subtle changes,
Right.
they can be painless, but
These
we
are
have our
warning signs.
responsibility. Yeah, we have our own responsibility to be aware. So this is what we call breast awareness.
But okay. Okay, one thing I'm trying to advocate for our women here is that they need to advocate for themselves, and that they need to take ownership and say, okay, instead of waiting for a doctor to tell them what to do, they have to start listening to their body and actually tell you, okay, I think this is the case, and be aware of that situation. In your past experience, what is the biggest hurdle that you have with most women, especially when they have been diagnosed to have breast cancer? What is the one thing, if you have to tell a patient, I'm sorry, but I think you have breast cancer, what is the first thing that you want them to know?
Oh, well, breast cancer is treatable.
Good.
All right, we can cure.
Okay.
Okay. Now we have lots of latest technology, and as well as very good treatment to identify the different types of breast cancer,
Yeah.
and then to give the specific medication. So we have seen very good results.
Okay.
Right? So they must not be scared. They must come forth and take the initiative to make a change for themselves.
Yeah.
Not only for themselves, because they are the pillar of their
Family,
own in society,
community,
in
yeah.
women, right?
Yeah.
They're the mother, right? And they are
Yes.
the wife, and
Yeah.
right?
Exactly.
And so they need to take the initiative to go for the treatment and
Yeah.
to get treated.
Yeah. I think
Yeah.
one thing that I think you and I both agree with is that to tell women that even if you have breast cancer, it is no longer a death sentence.
Correct.
Yeah, but you got to advocate for yourself. You got to be alert and don't be ignorant about all the signs, or don't even listen to your body when it's clearly telling you something is not right. And because the we have so much better medical care now, smart people like Dr. Teo here who's helping, and on top of that gives you solution not only in the care but the reconstruction. So I want to touch a little bit about reconstruction, Dr. Teo, is for me anyway, if ever, the fact that if I lost all my breasts, I would feel less of a woman, purely because it is kind of identify us as women. How does reconstruction work, and how does it affect the woman in your experience after treating so many people?
Well, so of course, those days when we detect late because of ignorance and sometimes in denial, a lot of our patients come in the later stages, right? In stage 2 and stage 3. Ideally, we would want them to come earlier when they are in stage 1.
Right.
Right? In the developed country, majority of the patients come in early stage 1.
Okay.
So for that, their survival is very high.
Right.
Okay, their outcome of being treated is very high. So if you come at the later stage, then of course it's a little bit lower.
Okay.
Right? So if you come early, then we can offer you more options of treatment.
Understand.
Right? So that's why because majority of our Asian patients tend to come in stage 2 and stage 3, often we have to offer a mastectomy. All right, a mastectomy where you remove your breast. And because of this fear of this from removing your breast, a lot of women fear the treatment, and then therefore that's why they do not come forth.
Right.
All right. Now, because we have such good treatment, even though you come in stage 2, stage 3, right, we can help you by giving you chemotherapy or certain drugs to reduce the tumor size.
Okay.
And if there's good response to it, we can remove your breast, and at the same time, we can reconstruct and give you a breast back.
Wow. So all in one go, kind of.
All in one go, absolutely. So this is what we've been practicing for the last 5 to 10 years, and I think more and more women are accepting this.
Okay.
So they are not so scared, and they'll come and say, yeah, I can accept that I have this, and I want to do a reconstruction.
Wow. It's amazing.
So, we can do it at the same time. So they'll have we can keep the skin and the nipple. Okay. And then we can remove the breast inside, and then after that we will replace it with other parts of your body.
And the recovery would take what, 2 months? Just a general.
Yeah, well, about 1 month plus, 1 to 2 months. Of course, this is the initial recovery. Yeah.
Oh, wow.
Yeah.
See, ladies, there's hope. So I just want to share and say thank you a million times, because what you share to us and to our audience is invaluable. And if I can just save one person to go to the hospital and see a doctor if they are not feeling well, I think I've done my job. Yes. It's amazing, and I cannot thank you enough. I hope that I can invite you again for a live session with our audience so that they can ask you live questions.
Yeah, I'll be more happy too.
Yes.
Yeah, I think it's great you're doing this work, because we really need to reach out to more women to take the initiative and be an advocate.
Yeah, I that's my goal here in life right now, and I'm so honored that you've taken a afternoon with me. I know you're super busy and patients are all waiting outside. So thank you so much, Dr. Teo, and I hope to see you again soon, and we'll do a live session with our audience. Yeah?
Yeah, will do.
Thank you.
Thank you.